Hi, friends. I decided to talk about Alzheimer's disease prevention because my lovely husband sent me an article a couple of weeks ago about Porphyromonas gingivitis bacteria that contributes, according to this article, to Alzheimer's disease. So I decided to do so. This actual article was based on this one published in Trends in Microbiology in 2021, stating that Porphyromonas gingivitis is a gram-negative root anaerobic bacteria that contributes to cardiovascular disease, Alzheimer's disease, and rheumatoid arthritis. I did a little bit research on this topic and I found out that pharmaceutical companies already are working on creating a drug. Look at this article from 2019 in Science Advance. They are saying that they're creating a drug that not only will kill bacteria, but also will inhibit the protein called gingivalis that from bacteria creates actually further damage to the brain and creating Alzheimer. Before we go and talk actually on about the treatment for gingivitis, I want to say a couple things. Why I think that there is something behind this idea that bacteria may contribute to Alzheimer. Not, by the way, not every person that will have gingivitis will have Alzheimer and vice versa. But I think there is something into that. Listen for that. Dentists have been talking about for that many years that every time with dental floss, we shower our blood with the bacteria. So that's number one. The number two is I want to give you a parallel example. We as medical professionals, we know that if person has a poor dental hygiene, they can have endocarditis. Staphylococcus aureus bacteria that lives here in the mouth and will start to circulate all over the body and will end up on the cardiac valves, creating a problem called endocarditis. So for those reasons, I decided, okay, probably there is something into that. So let's talk about what we can do to prevent Alzheimer's. And this basically video for people who wants to prevent Alzheimer's, and maybe the gingivitis, the part of or one of the several causes to contributors to Alzheimer's. So address dental health and address your own immune system. So here we go. Number one, no simple carbohydrates. In every video of mine, I'm talking about no bread, pasta, pizza, cookies, candies, soft drinks, juices. So all of that has to go. No smoking. Number three, mouthwash with tea tree oil. Tea tree oil will kill all kinds of bacteria, viruses, fungus, and it will kill you if you overdo on that. Do not swallow. Do a mouthwash twice per week. Take maybe 1 or 2 ounces of water, 2 or 3 drops of tea tree oil there, and use it as a mouthwash and spit it out. Brush your teeth twice per day. First, one time is before bedtime because you don't want to go and sleep with the food debris there, and you close your mouth for 8-9 hours, and the food and bacteria will start to reproduce that in the presence of food and will just thrive. Second time after the breakfast. Also have an excellent video on my playlist called video number 12, bed breath halitosis causes treatment plan. Please see where I talk in great details about dental health. So I absolutely love gum stimulator. I love Sonicare toothbrush. By the way, I have a link there to not very expensive. They can be as expensive as $700. I think I have like for $50 or $60 one, and I use it for a long time. Already been using that for many years. I love Waterpik. Please use Waterpik no more than once or twice per week. Okay, because if you do that more to clean those packets that created by food between tooth and the gum, if you do it more, you can actually create more damage to the gums. And also, when you look precisely into on this picture, you will see that this device has a power setting, and it's not set on 10, it's set on 8. So the the water peak not very strong. It's on 8. And finally, I want to say a couple of words about fluoride and toothpaste. I'm against of adding fluoride into our drinking water. However, research shows again and again and again that fluoride makes our teeth stronger and helps to build actually enamel. Please use that. This one, the best that I found on the market. If you will find something better, please let me know. I am not going to talk in this video about diet and exercise for brain. There is a fantastic book. Please read on prevention of Alzheimer and diet and exercise for brain from Sanjay Gupta. Excellent, excellent book on this topic. Now, so this is information. You can contact me. I want to say a couple things. Okay. In 2021 or 22, I become very upset with the fact that Democrats were not able to push Part B of their bill. The Part B had dental care for seniors, couple visits, free dental care for seniors, free eye exam, and free hearing aid. And our comrades Republican and Joe Manchin get together with his friends, CEOs of big pharmaceutical companies, and they just basically block that bill. Okay, they call it always, oh, it's so socialism to give people 65 plus free visits, a couple of visits to a dentist. If it's true that gingivitis and gum inflammation contribute to Alzheimer's, I want to tell you something, okay? Free visits to dentists are so much nothing in terms of cost. You cannot imagine how much we as a health, taxpayers spend money on research and creating, giving the money to pharmaceutical companies for the drugs that we are buying from pharmaceutical companies to treat Alzheimer's disease. The amount of money that we as a taxpayers spend to care for Alzheimer's patients, provide for them assisted living and nursing facilities. If we take all of this money, if we can take all of this money from there and redirect them into prevention of Alzheimer, okay? Give them couple visits, 2-3 visits per year, 3 visits to dentists, and prevent gingivitis and prevent Alzheimer's, we will be so much better in general. Okay, guys, now you know my political orientation. Feel free to subscribe, subscribe, or don't like and unsubscribe. All relative information about me and my coaching services in the description below. Bye-bye for now.